Wonderful. So thank you everyone for joining us today. My name is Zoe Clark. I'm Senior Self-Management Programme Officer here at NASS. And today I'm joined by Colin Beaver, who is Matron and Senior Clinical Nurse Specialist at Portsmouth Hospital. Hi Colin, thank you for joining us. How are you doing?
Yeah, fine, thank you. Thank you for inviting me again to talk.
You're welcome. Thanks for coming again. It's your sessions are always really popular and really information packed. So I'm looking forward to another talk today. So for anyone who's not seen the ads before the session, today Colin's going to be discussing personal care for people with axial SpA. So he's going to be sharing lots of practical tips, and these can be helpful for when you're flaring, if you've got any high fatigue days, or if you have reduced mobility as well. So before I hand over to Colin, I will be joining him for a Q&A after his talk. So please do pop any questions that you have in the comments and we'll answer as many as we can at the end of the session. And if you can't join the whole session, then do come back later because the video will stay on the page so you can catch up on the full video afterwards. And I'll also keep an eye on the questions coming in from catch-up viewers over the next few days. And Colin's kindly shared the slides with us as well. So he'll be able to, I'll share a link to the slides after the live as well. So you'll be able to get all the info and links there. So Colin, before I hand over to you, do you just want to tell us a little bit about yourself for people who haven't seen our previous sessions?
Yeah, so I'm Colin Beaver. I've been in rheumatology nursing nearly 30 years now in various roles. And I have a varied role. So in addition to a nurse specialist, I also have other roles such as a matron for rheumatology services and service manager. So it's really good to be here, talk about something that is close to my heart. We all want to be nice and clean and tidy, and so hopefully you'll find this useful.
That's brilliant, thank you. So if you're ready, I'll hand over to you and then we'll come back for a Q&A afterwards.
Okay, so I'm just gonna... Sorry, I'm just having...
Are you able to mute the sound on your computer as well, just because that comes through on the audio?
Closing that down. So, hopefully you can see my slideshow now, everyone.
Yeah, well, you can see the PowerPoint, and then I think it's just loading now.
Okay. Is it up, running?
Not yet, it's thinking about it. Oh yeah, perfect.
Okay, so welcome everyone. I hope you find this useful. It is a difficult subject because we'll be talking to people who've got new AS, axial SpA, right through to people who've had longer standing axial SpA. So some of the things I don't want people to worry about, you're not necessarily all going to suddenly need to have all these supports, but just give you some ideas about what you can consider, as Zoe said, during things such as a flare or if you've got extreme fatigue. So personal hygiene is a difficult subject also because we don't often talk about it with friends, and we might not even talk about it to our families. We will often discuss concerns we may have with our next of kin, our loved ones, but to the family as a whole, we probably don't discuss them. And as I said, it's something we don't always discuss with friends. But it is something that everyone should be aware of, that the role of the clinical nurse specialist and some of the physiotherapists with a specialist in ankylosing spondylitis and AS, axial SpA, are there to help you if you've got specific concerns about yourself. So I'll be talking generally about some of the ideas, but actually you may need some additional support following today's talk. So personal care is key to everyone. As I said, we want to look after our bodies. We want to keep them clean and tidy, and because it makes us feel good about ourselves and also keeps us healthy. We know that being clean and tidy and smartly turned out is really important for our well-being, and we know studies in things like hair care, nail care is really important to us as well. So we want to make sure that personal care is a focus of anyone's support program if needed from their healthcare professional. What we know with axial SpA is it's an overlap, and there are some features that are more problematic if you've got more of the overlap conditions such as the psoriasis, irritable bowel, inflammatory bowel. and even the eye problems. So we will talk generally about some of those subjects, as well as some of the features that may affect you, as with the spinal disease and the peripheral joint pains. So we're going to start top to toe. I love these cartoons and pictures. It always makes me laugh, but actually this has a serious note to it as well. So one of the things that we do know, and what causes a lot of people concern, is around hair loss. Now, when we're looking after our hair, whether we brush it or wash it, we can expect to see a number of hair strands that we lose every day, but they normally replace themselves quite quickly. And there may be other reasons why your hair is either thinning or becoming brittle or causing you concern. So patients or people living with axial SpA may be really anxious if they notice that their hair's thinning or gradually falling out in more frequency. So first thing is to remember is that we all do lose our hair as we grow older. It tends not to be so thick, and the quality may deteriorate as we get older. There are another number of medical conditions that may affect our hair loss and hair thinning and hair quality. And one key thing is thyroid disease. So we know with people with an autoimmune disease, thyroid disease is part of that category. And it's always worthwhile having a conversation with your healthcare professional, your GP, that if you have got hair loss, is the hair loss due to another condition? There may be other hormonal imbalances, such as the sex hormones, as well as other conditions such as diabetes, iron deficiency. And what the key thing is that actually, if we're under a lot of mental health and stresses, that can also contribute. When you also look at other causes such as medication, hair loss can be a side effect of many medications. And while some of the medications that we use in some of the conditions is always highlighted, it's always worthwhile, once again, just rethinking about any other new medications that you may have started. And they include things like antidepressants, cholesterols. But of course, all of you are going to be aware of, you are related or are often on a non-steroidal. And non-steroidals can be a contributing factor. So it's worthwhile, once again, having that conversation with your healthcare professional to make sure that they've excluded all possible causes. As we lose weight, there is some research to say that significant weight loss may be a contributing factor. True alopecia is rarer, but it is a condition whereby the body's autoimmune system is attacking the hair follicles, which hold the hair in place, and this can then also cause hair loss. And often for people with alopecia, you may need to be seen by a dermatologist just to make sure there's no other cause for that. Now, for those of you who've got the overlap of psoriasis, then you may notice that actually you have this scab or these plaque scabs that form in the scalp. And often people get really, really anxious about this because people believe they've got dandruff. Now, there's quite a significant difference between dandruff and psoriasis in the scalp. So as you'll see from the photograph on the left, this is where you've got these plaques, this inflamed area of skin with overproduction of the skin cells that leave these shiny or thick plaques of psoriasis. Dandruff tends to be more flaky and appears actually away from the scalp. As the skin moves off the scalp, it moves towards the hair, away from the hairline. So there is a significant difference. But as I said, people get really, really worried about the difference in psoriasis and dandruff. If you're worried at all, once again, do speak to a healthcare professional. You may even just want to have a word with a local pharmacist, as they may be able to advise you what types of hair treatments or shampoos that may be good for the dandruff, or if you've got the psoriasis. And the other thing is, often people who've got hairline psoriasis, it does often appear on other parts of the body. So you normally know that you've got psoriasis rather than dandruff. There is a really good booklet. It was produced by the Psoriatic Arthritis and Alliance, and this is a really good book about how to manage scalp psoriasis. So in addition to the resources that you may find available on the NASS webpage, you may want to also reach out to other organisations that provide information about specific things such as psoriasis. So this is a really good booklet. It talks about how to manage it and also things to consider if you have significant scalp lesions or the psoriasis patches. People are often embarrassed, especially if they're going to hairdressers, because these skin psoriasis plaques, they do really stick to the bottom of the hair, and you may have to be careful about using things, especially ladies who have hair dyes or hairsprays or even things like perms these days. So when you look at, once again, visiting the hairdresser, unfortunately, because the Axial SpA affects your neck, you may find it really, really difficult to get into a comfortable position at the hairdressers. So once again, be very up and honest with the hairdresser. If you are finding that they're putting you into a back sit basin or a forward sink basin and you're struggling, they may be able to adapt what they're doing for you if they need to wash the hair. And be prepared, once again, if you're someone who's having lots of treatments to your hair, maybe in colouring or perms, the duration of that sink may be longer than if you're just having a hair wash. Outside of the hairdressers, if you're having a particularly bad day and you're struggling to wash your hair and you feel you need to, the feeling of having nice clean hair is something unique to everyone. But you can buy these things. These are microwavable shower caps. So what you do is you put the shower cap packet into the microwave, you heat it up to the recommended time, and then you can place it on the scalp, and it saves you actually having to have a full wet head, but it does freshen the scalp up. And those of you who may have got shoulder problems because of the axial SpA affecting the cervical neck and the shoulders, upper thoracic area, if you are struggling, there are things like long-handled brushes and long-handled combs which are useful. I have seen people being really imaginative. They've just sellotaped a comb or a brush to the end of a coat hanger. But these days, these adaptations are quite reasonably priced from either places on like Amazon or even some disability equipment shops. Mouth and mouth care is important for a number of reasons. Not in addition, once again, to our personal health, we want to have a nice clean mouth, but definitely if you are on medications such as immunosuppressants and the so maybe sulfasalazine or even the biologics, because it's an early sign that you've got problems if things like you're having bleeding gums. So mouth care is regular. You do need regular dental checkups. Mouth care, in general, just cleaning the teeth at least twice a day, and even considering using flossing between your teeth if you're not currently doing it. But you must see someone if you notice bleeding gums. There are some of the side effects of the biologics and disease-modifying drugs, medications that may cause you concern. So if your gums are bleeding, do seek the advice of your local dentist. If they're painful or swollen, or you've noticed bad halitosis, bad breath. But do also, once again, consider seeking advice, especially if you're noticing your teeth are becoming loose or falling out, or you've got any additional ulcers appearing in your mouth. So don't take that as normal. Do seek advice should you experience any of those problems. So mouth ulcers. So some of the medications that we do use, not so much in the biologics, but if some of you may be on methotrexate in addition to a biologic, we tend not to use methotrexate too much for axial SpA, but for people with significant peripheral joint disease like knees, hands or shoulders, now we may add in methotrexate. These can be associated to developing mouth ulcers. So there's lots of tips, once again, about what to do if you develop a mouth ulcer. They're not the most pleasant things. They put you off your food. So things like a soft bristle toothbrush, drinking cool drinks rather than hot drinks, and using perhaps a straw. During the time that the mouth ulcer is prevalent, you may want to eat softer foods. Once again, ensuring that you're having a healthy diet, because we do know that an imbalance in diet or an unhealthy diet may contribute to some of these features. And not to worry, if there's a mouth ulcer that isn't settling, then do seek the advice of a pharmacist who may be able to give you some specific mouthwashes or gels or sprays. They can also sometimes prescribe or recommend some of these corticosteroid lozenges. They're low-dose steroid tablets or lozenges that may help. And going back to the old fashioned way of just salt saline mouthwashes may help. But if that mouth ulcer lasts for a longer period of time or keeps coming back, then do seek advice from your GP or dentist, because you may need further investigation into that to ensure that there's no significant other problems. So cold sores or Varicella-zoster infections. Now, you'll see there are a number of stages. Often those who've suffered from cold sores are aware that they may be coming because you have that unusual tingling sensation, itching or soreness in the areas where they normally appear. Suddenly they then appear into these little hard blisters, and then finally they may burst and then scab over, and then the scab falls out. The key thing is that some of the immunosuppressive biologics may make you more susceptible to cold sores. So it's once again being aware of that and having a conversation with your healthcare professional if you are prone to cold sores, because they may need to prevent you having or not recommend certain biologic treatments. So these are, unfortunately, these do affect a number of people. Once again, your pharmacist can often recommend creams to ease the pain and irritation, and also antiviral type creams that will help. You can also buy these little clear patches that you can put over the sore patch, sore areas, which helps the wound to heal quicker, or the wounds to heal quicker. Once again, there's quite a lot of do's and don'ts, especially if they're painful. You do need to make sure you're trying not to spread it to other family and friends through kissing and things like that. So it's important to be prepared. If you're known to have them, then once again, always keep some of this creams or the antiviral creams at home, so when you need them, you've got them ready to use. Also, remember, when you are using these sorts of creams, you do need to make sure you're using a cream that's in date rather than out of date. And I've known that people perhaps go to their cupboard and suddenly the cream they want to use is out of date. Is likely not to give you the same benefit. And there is also some recommendations if you're using a sunblock lip balm that may help, because some people do find that the cold sores can appear if they've had a bit of sunburn to the lips. So time for a bath and a shower. Now, we're either often a bath person or we're often a shower person. I personally love a shower Monday to Friday because it's quick and easy for me to get ready to go to work or when I'm home in the evenings. But often, if I've got time, sitting in a bath is quite relaxing. But as with AS, and it can affect mobility and range of movement in things such as your hips, getting in and out of the bath, you may find that you could use with some adaptations. Most of these can be, once again, purchased from someone like Amazon or other reputable businesses that support supply equipment. But for the people who are struggling, you may want to ask for an occupational therapy home visit, because getting in and out of a bath is a risk. If you're not safe getting in and out of the bath. So the top left screen, you'll see a bath board. This often sits either on the rim of the bath top, so you don't actually fully get into the bath, or it can be put into the bath at a lower level, so you don't have to get right down into the bath. The next down one is a seated area. Unfortunately, this is one you definitely won't be able to lower yourself into the bath, but you may be able to use a shower adaptation to sit in the bath and have a shower. It's quite good, this design, because it allows you to sit on the side of the bath first, then move your legs in and then slide across into the seated position. For anyone who really struggles, there are a whole host of new products on the market. Most of them are not necessarily funded by the NHS. So you've got these bath raisers that fit into a bath. They're not necessarily permanent. Some of them can be lifted out so the rest of the family can get in and out of the bath as normal. And there are some that are more permanent. So I would encourage you to discuss with an occupational therapist if the previous two options aren't available for you or suitable for you, that you may be eligible to have one of these automatic bath lifts. And then, of course, once again, not funded necessarily on the NHS, are some of these especially adapted baths, whereby you could walk into the bath, sit down, shut the door, and then run the bath as normal. They're really good options, but they are expensive, and as I said, are not normally available on the NHS or social care. Also, if you're using a shower, if you struggle to stand in the shower for some time, using a seated shower stool may help. The one on the left hand side you can see has an ability to raise it to different levels and heights. The one there doesn't have any hand or rails on it, but you can also purchase ones that have handrails, so it allows you to ease yourself into the seated position and also to stand up. Remember, at any time, even with the baths and the showers, to put in something like a slip mat, just to make sure that when you're trying to get out, you've got a good footing and not going to suddenly slip and fall and hurt yourself. If you do only have a bath and it's not a suitable bath, you may be able to apply for some adaptations through social services to have a proper shower fitted, or even what we call these days these wet rooms. So this is key. If you can't, once again, manage with the over-the-counter or off-the-shelf type equipment, that a community occupational therapist may be able to help you. Now, just remember a few things about bathroom safety and shower safety. First of all, if your bath is too hot or too shower, you can find that you can faint afterwards. As your blood it flushes to the surface of the skin, you can suddenly drop your blood pressure a bit. So I would stay clear of very hot baths because it can cause problems. As I said, getting in and out of the bath is also a problem for some people, and making sure you may either have grab rails or these non-slip mats are important. If you're using slippery bath oils or bath and shower treatments, you need to ensure your safety, because the last thing you want to do is to try and get out of the bath or the shower and then slip over and have a nasty fall. And unfortunately, we've heard of a number of patients who have got out of a bath or a shower and had a significant fall and then caused them problems with their cervical neck. If you're really, really unsure, look at purchasing something like an alarm system, so you've got a member of the family downstairs, and should you need them, you can pull a call bell. These are reasonably priced. There are some that just fit into sockets, plug sockets, so you don't have to have them fully fitted, but they're a good idea if you are upstairs away from the family and you were to have an accident. You can pull these calls or have an adaptation around your neck so you can call for assistance. And this is key things for people who are unsteady in the bath or the shower. You may want to make sure that you only ever have a shower or bath when you have got someone at home, is an extra way of safety to ensure your own, prevent risks of falls. Now, the other thing always is to remember that when you're on holiday, when you're going abroad, what you're used to at home may not be in place when you go abroad. And I've been in hotels whereby the bath is really, really small, or the shower is really difficult. You have to get into the shower, you have to lift your leg into a bath area. So you may want to have that conversation with any people hotels you're going to stay with to see whether they have got a disabled access bathroom. Now, just be aware of that. I recently stayed in a hotel where I was allocated a disabled person's bathroom, and for me it was really, really difficult, because all the things like the mirrors and everything was at a lower level to accommodate people probably in wheelchairs rather than someone standing. So then you actually got bad posture when you're trying to have a shave or clean your teeth and you want to see what's going on. So look ahead, and as I said, make sure you perhaps have a conversation with the hotelier about the sort of equipment and bathrooms that may be available for you. So accessing the toilet, we probably talked about this in a previous talk about being at home, but what is really difficult is that often we want to feel clean after we perhaps have a bowel action. The good things are, if you can't afford an installation of a bidet, you can get adaptations that fit to your normal toilet with like a shower head on them, which allows you to use the bidet or the toilet as a bidet. There are bizarre things out there, and once again, I've heard of a lady who used to tape toilet roll to a wooden coat hanger because she struggled when she had bad pains in her shoulder to be able to wipe her bottom. She didn't like asking her husband to wipe her bottom for her, so she had adapted. But the good thing is, once again, in this day and age, you can now buy these adaptions that allows you to clip toilet paper or wet wipes into the adaptation, which allows you to be able to clean yourself quite quickly and easily. Just remember, there's lots of controversy about wet wipes being put down toilets because they can block the system or the environmental impact. So it may be you need to have a bin or something like a nappy bag where you can put the used wet wipe into. If you struggle to get on and off the toilet, then you've got, once again, both raised toilet seats or raised toilet seat frames with handle raised to help you get in and out. And just the guy with the bottle of water, he's made his own bidet by just filling a normal bottle of water, or filling a bottle of water and then making a small puncture hole in it to allow you to be able to squirt the areas that you need to make sure that they're nice and fresh and clean. So going back to the psoriasis, now not everyone with ankylosing or axial SpA will have psoriasis, but it is something that a group of you may have overlapping condition with the psoriasis. So some tips about managing psoriasis are rather than using a hot bath, then try and use a lukewarm bath, just because it helps to soothe the skin. Be very careful on the moisture or the bath products or shower products you use, because they can over dry the skin, which can irritate the psoriasis. The research, once again, to prevent drying of the skin is limit the amount of time you're in a bath or even in a shower for less than 15 minutes. As I said, bathing in lukewarm may soothe the psoriasis. Cleansing with gentle soap or prescription soaps as from your consultant or your GP. Instead of rubbing the patches of dry skin, patting the skin may once again prevent the irritation, because it does become a kind of an itch, scratch, rub type cycle, which can contribute to further damage of the skin. And applying the moisturizers is important. Often when the skin is still moist, it will help prevent the drying of the skin. Now, this is something you, once again, within the safety you have to be aware of, because if you're putting moisturizers on damp skin, you may find that when you try to stand up or get off something, you're a bit more slippery if you've got the moisturizer on your hands. So just once again, just think a bit about safety. If you've got troublesome plaques, there's lots and lots of ideas out there. These are the plaques that often are thick. They are quite unpleasant looking. They can often bleed, causing lots and lots of personal distress to the individual. I learned when I attended a psoriatic arthritis conference many years ago that if you've got a significant troubled plaque, putting perhaps the cream under some cling film and then will allow the cream to be absorbed into the skin, rather than, once again, if you then suddenly put clothing or go to bed where the actual cream seeps into the bed linen or the clothing. If you've got other troublesome areas, such on your hands or your feet, these days you can buy these cotton gloves and socks, which you can use. Now, don't necessarily wash them every time between use, because they will get a nice thick layer of cream within them, which will help them prevent absorbing more of the moisturizing cream. So you do need to perhaps wash them every so often, but you don't need to wash them after every use. But they are very good, especially if you've got plaques and psoriasis on areas such as your on your hands and on your feet. Foot care is really important, and you'll know that if you've got AS or axial SpA, you may struggle to get down to your feet, so you may want to treat yourself, perhaps to someone coming in and helping you, or persuading a family member to do your feet care for you. Make sure that the toenails are trimmed. You don't want toenails that get unwieldy, because it becomes more difficult to manage and also can affect mobility or pain when you're putting on shoes. Soaking your feet in warm water every so often or regularly will help keep any fungal infections away. And if you are, once again, using any oils or treatments, just make sure they're not too slippery. If you can use a scrub brush, whether it be a long handled scrub brush, so you can give the toenails a good clean. This will also prevent fungal infections. You may want to use other treatments such as massage oil, creams and lotions, and also things like pumice pads or treatments for calluses. Because once again, you don't want to get a callus area that can suddenly ulcerate under the callus. Once the skin has gone really thick, sometimes you don't necessarily notice that actually a small ulcer is starting to appear under that callus on the foot. You can also buy these long-armed mirrors. This one's a short-armed mirror, but where you can actually look underneath the feet to see if there's any skin damage or significant areas of thick skin. Toenail cutting, we're quite imaginative about this. I definitely can't, I've never been able to bite my own toenails. So it is a problem. Once again, as soon as you start to notice that you're getting less range of movement in both your spinal area, your neck, or even in your hips, you may find that you do need to seek advice and support from a chiropodist or chiropodist. Now, they can be expensive, private chiropodists and podiatrists, but there are some organisations such as Aged UK and sometimes British Red Cross where you can look up and see if they offer a local nail service. They are very cautious. They normally don't treat anyone who's got an overlying diabetes. Mostly those patients are being serviced by the NHS, chiropodists and podiatrists, but they are good for a service of people who do struggle to keep their toenails short, or even if they've got problems with calluses and corns, etc. So just search Aged UK. You can put in other, just search for local foot care services. More locally to us, we've got one called Tiptoe, which is an organisation that supports people in accessing and supporting them with reasonably cost nail cutting and feet care. So there is always a need. So some of the things we've talked about is having a plan B. If you're having a bad day and you struggle to get in and out of the bath, or struggle with some of the home personal hygiene care needs, how are you going to ask for assistance? Now, waiting till that happens is not often a good option, because you've then got to wait to put into motion the care and support you need. So do think about, if you're having a bad day, what can't you do for yourself, and where you may need some assistance, either from a family member or whether it be private personal support. And the other thing is plan ahead. So for bad days, in addition to be prepared, you've also got to plan ahead. Do you need any adaptions that are ready for you to use? You may find that you don't need a grab rail in the bathroom every day, but should you have a bad day, you may need to have that grab rail put in. And once again, if you've got to wait for it, then that can take a few days, weeks to actually get installed. So think ahead what you need and what you need to think about should you have a bad day. So planning ahead also includes, as we previously mentioned, maybe looking at where you're staying on holiday, how you're going to, and that only includes is about how you're getting off onto bed, but actually your bathroom facilities. I've been to hotels once again where either the toilet seems to be in a bad position. Some people may find toilets are too tall to get on and off, or they might find they're very small. And if you haven't made a plan ahead, maybe taking your own raised toilet seat, you can struggle. And more recently, I was talking to a lady whose family were desperate to take her on a camping holiday, because as children, she would take them on camping holidays, and she wanted, the children wanted her to go away with their grandchildren on a camping holiday. And she suddenly found that she was in the middle of a field, and whilst they'd made a provision with a mattress that could be raised, what she found the difficulty was she went into the shower block that didn't meet her needs. So she's ended up having a whole weekend not being able to have a shower and feel refreshed. So do think ahead and think about what you need to problem solve to ensure you've thought of ahead. So as I mentioned, an occupational therapist is a key member of the team, multidisciplinary team. There are a number of occupational therapists, mostly employed in hospitals of what we call secondary care, are people like occupational hand therapists. So they're looking at hand function. So if you've got any hand function problems using with personal care, they may be able to advise you. Then you've got the next level, which are the occupational therapists that work often if you've had been in hospital for a stay for an operation or been unwell in another way. Now, they will be able to often give you an assistance in getting you back home with provision of equipment, but it often is temporary equipment, not long-term equipment. But the key people, if you're looking ahead, are the social services occupational therapists. So you find these on your local council web pages. They're mostly self-referral. You don't need a healthcare professional to refer you to them. And they're the ones that will come in and assess and give you advice on adaptations and equipment at home to allow you to self-care as best as possible. So 3 levels of occupational therapists. Different health authorities may have different, and social services models may be around, but once again, either ask your local rheumatology nurse specialist, physiotherapist, or once again, you can search through the social services. Often they're down under the care of adult social care, so people don't necessarily know where to go and find them, but they are really a good resource. They can good at signposting you as well to other support you may need in the community. So I'm just going to briefly mention PIP to a certain degree. So the personal independent payment, those of you who have not claimed it currently or who are claiming it but may be up for a review, if you look at the elements, you are entitled to apply for that if you need assistance with washing, bathing, using the toilet, dressing and undressing. Now, depending on the level of ability and disability may depend on the level of financial resource or support you may receive. But bear in mind, this is really good because if you do need to suddenly buy equipment or you do need to buy or purchase some support from a private home care person, then you've got that resource available, the financial resource available. So it's key, there's a number of messages. Don't leave it too late because once again, these processes can take some time to go through. And if you do go through the process, you may find that you're having to appeal at some point. So once again, don't wait to the last moment, think about it. We'll talk about it in a minute, but NASS have someone who can support you should you need support in making the application or in the event of an appeal. And what often people do is they undersell their support they needed by reporting a good day rather than a bad day. So a day that's different if you're having a flare, including fatigue, but also mental health and general well-being. If you're low in spirit, that can also affect the level or support you need to demonstrate within your application. And definitely with any other additional joint pain, you may want to be explicit how that affects personal hygiene. There are a number of organisations, so I've taken this from the MS Society that have got a really good section on benefits and how to word things and what to consider. And as you'll see from this one, whilst they may be talking about what you need in the physical support for equipment with personal hygiene, they also recognise the fatigue element is a key factor. So don't once again miss to talk about how the fatigue element may affect your personal hygiene. They talk about a diary. So once again, looking at elements of personal care where you're struggling. Now, be very honest. Don't if you're too kind on yourself, then you're likely to either be rejected and you need to appeal. So it's key to look at around citizens' advice. Once again, may be able to help you locally if you're making an application. Key thing also is once you have received the form, you are limited to the number of days that you can return that form, and you may have to appeal. So if you struggle with the form, if you've left it too late, you may find that you've got to go through the whole process again. Remember also to mention any safety concerns that you have. So whilst you may find it easy to get in and out of the bath, should you have a fall and you were to be on at home on your own, how would you cope? So remember to also think about any safety aspects of PIP around personal hygiene, because it once again may allow you to get the higher level of attendance or PIP allowance. You may want to talk about good days, but also even think about what the bad days. So you could say that within perhaps a week or in a month, you may have 4 or 5 good days or 3 or 4 bad days. So it will be different. And those bad days, some people who are on biologics or on medication may find that actually, if you're on a medication that's say every 2 weeks, that you do well for the first 10 days, and then suddenly you start to notice more joint pains. If that's the case, definitely do have a conversation with your rheumatologist, because it may be that your medication isn't at the right level for you and you may need it to be adjusted. But if it is something that you find the medication works exceptionally well for a number of days, but then you have a few days, then also explore that in the application. And then the other symptoms, such as I said before, pain, breathlessness, increased fatigue and tiredness, having a bath or shower can take it out of you. You can get undressed, getting in and out of the bath or shower, and then drying yourself and then getting dressed again. So don't underestimate when you're doing the PIP applications what you need to add in. There's a number of examples on other web pages. This is once again coming from the Citizens Advice Bureau, with some statements that you may find useful to put in when you're considering your application. So it is something to be aware of. It's not easy. They can be quite daunting, some of these forms. I said the Citizens Advice Bureau can help you. But the nice thing, or the great thing from NASS is that you are able to access a member of their team for support and advice. So on the NASS webpage, you can find information, and Gary is the guy at NASS who can help you navigate some of the benefits that you may be eligible, which may help with personal care. So that's the end of the presentation. I'm conscious I've been talking for some time. There is an opportunity, if anyone has sent questions in, to now go back to Chloe.
Hi, Colin. That was brilliant. Thank you.
Have I stopped sharing?
Yes, yeah, I can see both of us now, so that's great. That was brilliant. As I said, your sessions are always information packed, so thank you for that. And yeah, I could definitely sort of second some of those pieces of advice. I find things like the shower seat and things like that really helpful, whether it's on flare days or just generally. So yeah, really great tips. Thank you. And for everyone watching, I will share those slides, or a link to the slides, so you can download those afterwards, so you can have a copy of all those tips, particularly those tips for the PIP application as well at the end. That was really helpful. Brilliant. So we don't have any questions at the moment, but for anyone watching, please do pop any questions in the comments there. If you'd like to email them over to me, you're welcome to email them over to zoe@nass.co.uk if you'd rather than posting them publicly. So yeah, thanks again, Colin. Was there anything that we hadn't sort of covered that you wanted to mention or anything?
No, as I said, the key thing is don't leave it too late. And we often are bad at leaving to the last moment and then struggling. So being prepared is my key message for living with any long-term condition, but even with AS. You know yourself, you know if things are getting worse, a bit more painful, a bit more stiff. And once again, what you don't want to do is get your situation whereby you're stuck and then struggling. So think ahead, talk to other NASS members. I think the NASS people who go to NASS hydrotherapy sessions or NASS groups really do benefit from that friendship, but also some tips. There'll be tips that I haven't thought of that someone will say, or have you thought about that? So yeah, NASS is a really good resource, both on the web page, but also within the membership groups that are run. And even the NASS Members Day, I think, is fantastic for just talking to someone else about their ideas. Often we can, as healthcare professionals, we can come across as the very medical management of things and overthink it, where sometimes just a tip from a fellow person living with AS is really, really useful. We didn't talk about things like dressing equipment aids. There are things like if you can't get down to put your socks on, you can have these special devices to help put your socks on. Quick things about shoelaces and things like that. So there's a lot out there for support, but just think it through. Talk to your partners or your family if there's anything specific. Some of the items may be good for birthday presents or Christmas presents. You may not
Absolutely,
want a bottom wiper for your birthday. But they're reasonable.
Absolutely, yeah. And you go on lots of these websites, and there are lots of different things and different budgets out there as well for all of these different aids. But yeah, I think that's the whole thing with the PIP benefit as well, is it's to help cover those extra costs associated with living with a long-term condition. So if you're able to get that then helps with those extra tools and things that can make life easier.
Yes.
That's brilliant. Thank you. Well, Pete said thank you in the comments, and so has Anya. Anya said that your presentations are always excellent, and she often rewatches them and picks up new things each time. So thank you very much.
Thank you.
Brilliant. Well, I'll let you get back to your busy day now, Colin, but thank you again so much. That was fantastic. And for everyone watching, thank you so much for joining. And yeah, please do pop any questions in the comments or email me any questions afterwards, and I can pass them on to Colin. Wonderful. So take care, everyone, and see you next time, Colin.
Thank you.